Hi, I'm Anna Christensen, and I'm very pleased to be joining you today to share an update about the Italfarmaco Givinostat Development Program. So first, a few disclosures to get out of the way. I am an employee of a company called TRINS, a contract research organization. Italfarmaco has contracted with TRINS to provide patient advocacy services. Givinostat is currently in development for the treatment of Duchenne and Becker muscular dystrophy, but it is not approved for sale anywhere. This presentation is intended to share scientific information with the DMD community. So there's 4 things to remember when we're finished today. First, your muscle cells are supposed to repair themselves after they're damaged. And in Duchenne, this doesn't work properly. Givinostat is an investigational drug designed to make the muscle repair process work more normally. In a phase 2 clinical trial, muscle tissue tests, functional tests, and pulmonary tests showed a delay of disease progression compared with natural history data. And last, our phase 3 clinical trial is fully enrolled, and we expect to have results in 2022. So first, how do muscle cells repair themselves? And this is a normal process that happens in your muscles all the time. And it's something that is happening every day in your body. And so what's supposed to happen is that your muscles naturally get damaged. And this happens with perfectly normal things like working too hard at the gym or falling down and injuring yourself, things like that. So when that happens, a signal is sent, and that signal allows the body to release the inhibitory switch that is keeping the repair mechanisms in the off position. So it allows the repair mechanisms to move forward. And when that happens and those repair mechanisms are activated, the proper function of the muscle cells is restored. And then the whole system goes back to the off position and it waits for the next time your muscles are damaged. So this is what's happening in your body all the time. If you're someone with Duchenne, you still have this process, but it doesn't work quite the way it's supposed to. So if you're someone with Duchenne muscular dystrophy, that means you might not have dystrophin, the protein in your cells. And normally that protein is supposed to help your cells avoid damage. So if you're someone with muscular dystrophy, your cells still get damaged, but they get damaged more often. And what happens though is that the signaling system is interrupted. And so what that means is that the repair mechanisms are not efficient the way they're supposed to be. And that means that scar tissue and fat cells accumulate and muscle cells can't function the way they're supposed to. So this is the process that's happening if you're someone with Duchenne muscular dystrophy, that your body is trying to repair it, but it's not working very well. So how does Givinostat work? So first, it's important to know Givinostat doesn't change the fact that you might not have the dystrophin protein. So you're still going to have more damage than normal. You'll still be starting out having some fat and fibrosis, and your natural repairing mechanisms the signaling still won't be working the way it's supposed to. But Givinostat acts like that missing signal and that would allow the repair mechanisms to go forward. And what we're hoping is that this will reduce inflammation, increase muscle regeneration, and reduce that fat and fibrotic replacement that we see with people with Duchenne. So that's the idea, and that's what we've been studying. So my colleagues have shared updates before, so I'll just go over a high level of the data we have so far. So first, they looked at a mouse model of Duchenne muscular dystrophy, and the mice who received the Givinostat showed increase in muscle fiber diameter. It was bigger fibers. They saw a reduction in fibrosis and inflammation. So those markers of the system not working well, those went down, which is a good thing. And they showed better performance on a mouse treadmill test. Then they ran a phase 2 clinical trial of boys with Duchenne muscular dystrophy. And on their biopsies, they saw an increase in muscle fiber diameter and regenerative fibers and decrease in that tissue damage, inflammation, and fat, just like we saw in the mice. They also did muscle MRI, which showed slower disease progression with among subjects treated with givinostat compared to historical data. So all those are good things. In addition, we have safety information on a large number of subjects because givinostat has been studied in other indications as well as muscular dystrophy. Overall, we see mild side effects, including a reduction in platelet cells, diarrhea, abdominal pain, vomiting, and increase in triglycerides in your blood tests. So all good information. And one of the things that they've been doing is for those boys who received givinostat in the phase 2 trial, they have continued to follow up with them in an open label extension study. And what they do is they compare how they do with some published data about people in a natural history study. So on the left, you'll see the natural history participants who over time, more and more of the boys are losing their ability to walk. And on the right, you'll see the boys who were in the phase 2 trial who have continued to have follow-up for over 6 years. And what you see is the curve is still the same shape. So people are still losing function. The difference is that the curve is shifted to the right. So those same milestones are happening later. So you'll see that the loss of ambulation age in the study is 15.2 years compared to 13.4 in the Duchenne natural history study. And overall, we see the same patterns of delayed disease progression in time to rise from the floor and pulmonary function testing. So, which brings us to our phase 3 trial, which I'm happy to share has been fully enrolled. And this was a randomized, double-blind, placebo-controlled study. And the primary objective is to demonstrate that givinostat preserves muscle mass and delays disease progression. We did share last year that we finished an interim analysis, which showed that the study was not futile, which allowed us to continue with the rest of the study. We enrolled our last patient in September of last year, 179 boys worldwide, and we're expecting to get final data in the second quarter of 2022. The study included boys who had DMD, were ages 6 and older, were able to walk, climb stairs, and get up off the floor, and were taking steroids. They needed to be able to do an MRI. They had to be able to do the stair test consistently, and some boys were limited in whether they could participate based on how much fat they showed on MRI. People could not participate if they had been taking investigational drugs recently and or any other muscle strength drugs or idebenone, exon skipping, premature stop codon read-through drugs, or other drugs that affect strength and muscle function. And they also needed to be healthy enough for the study, and they couldn't be having surgery soon. Overall, the study was designed to have 3 different parts. The first part was screening, where everyone completed 2 screening visits. And then if everything was okay, they had their muscle MRI. And then if they still wanted to participate and everyone was still eligible, they went to a baseline visit where they were randomly assigned to receive oral liquid givinostat or a placebo oral liquid, which doesn't do anything. And they had more study visits in the beginning of the study than at the end, and that's so they could adjust doses as needed for any adverse events. And they continued doing this for 72 weeks, and they're receiving 2 follow-up MRIs. And then at the end, everyone is given the option to enter an open label extension study where everyone gets the active givinostat. So that's the study design very briefly. The tests that we're doing are very similar to ones you will see in other studies and in your clinical visits. So we do obtain written informed consent, which is how we know your family wants to do the study. We do physical exams, cardiac tests, lung tests, blood and urine tests, and there's a questionnaire and diary. We are doing functional testing to see how whether or not your function is changing. So we're doing a 6-minute walk test, North Star ambulatory assessment, 4-stair climb, manual quantitative muscle testing, and 3 of those muscle MRIs. And the study drug is taken orally twice a day after a meal. After the main study, participants are invited to participate in an open label extension study. And the purpose of this study is to really learn the long-term effects of givinostat on function and strength, respiratory function, daily activity, and quality of life. And so what that means is participants receive the active givinostat oral liquid suspension, and they continue on that until the FDA approves it. They still have more visits at the beginning of the study and then continue with one study visit every 4 months. So thank you so much for joining me for this overview of our program. If you want to learn more, there's 3 things you can do. First, you can look at the clinicaltrials.gov and search for the number listed there and learn all the details. You can watch one of our recent presentations, or you can always email or call us anytime. Finally, we would just really like to thank all of the families who have participated or screened for one of our trials, who have participated, all the trial sites and researchers, and all the patient groups for your hard work and support. We really appreciate it, and we couldn't do without you. Thank you.